Greetings, everyone, and welcome to what we are basically billing as a beginning of a webinar series that will take a look at mental health issues and what some psychologists are calling a mental health crisis. I am Joyce Davis, and I am PennLive's Outreach and Opinion Editor. But I am also here in my capacity as President and CEO of the World Affairs Council of Harrisburg. Both PennLive and the Council are collaborating on this series that I think will provide some crucially important information for us as we hopefully are emerging from a pandemic. I mean, we can only hope. But today we're going to really focus in on the issue of violence and mental health. And to lead us in our discussion, of course, we have our trustworthy, always willing to help Commissioner Thomas C. Carter, an old colleague of mine when I worked for the city, and he is here to help us shed light about this surge in violence that we think we're seeing, not only in the Harrisburg region, but throughout our region, throughout the nation, frankly. But we also have with us Dr. Marissa Brown, who is a psychologist with UPMC. And in one of our webinars, she first raised the issue of a mental health crisis with us. And so I'm bringing her back so that she can perhaps shed a little more light on where we are with that. We also have with us Sharon Engdahl, who is Executive Director of the American Mental Wellness Association, and Tina Clymer, Administrator at the Carbon-Monroe-Pike Mental Health Center. So I want to welcome all of my guests. Welcome, everyone. You can unmute yourself so that you'll be prepared to share in the discussion. And we thank Candace Rice, our program assistant, for being here with us as well, even though she is not on camera. So let's see, I am going to do this so we can begin. I think I'd like to begin our conversation with Dr. Brown. Dr. Brown, you raised the issue of a mental health crisis. And so what I'm going to ask you now to just share with us why you and many other psychologists believe we're really facing a mental health crisis.
So even before COVID, we were seeing a large spike in numbers of adolescents and youth being diagnosed with anxiety or depression. And on top of that, about a large number, I'm not going to say some statistics because I'm blanking on the statistics right now, but a large number of youth have indicated, thoughts of suicide or self-harm, or even have attempted suicide. So that those numbers have all been on the increase and on the rise in the past couple years. Coupled with, now we are coming out of a pandemic, and significant shifts in home life and school life, and just how people have been interacting and socializing. And on top of the final piece is the lack of access to mental health services, and just not having enough outreach happening and intervention happening. So those are, it's a perfect storm, in my opinion. And I think that's what we're all looking at, is that we're seeing this large increase in numbers. We're seeing individuals asking for help, but then the arduous process of trying to tap into the limited resources that are out there and available.
A perfect storm of more need and not enough resources. And that does that sound like your experience, Tina?
Yeah, it certainly does. And throughout the pandemic, when kids weren't in school and they weren't doing their normal activities, where some of the anxiety and depression is typically diagnosed or recognized at first, and there are referral sources, they weren't there to be the support. So now that they're going back about their normal business, we're seeing more and more need, and trying to ensure that the services are available within the community is a difficult task.
I see. Sharon, let's bring you in. I know you've been doing this a long time. This is your, as you say, your passion and your expertise. What are you seeing?
Well, this is my heart. I have given 50 years to this. And what I know is that we had a broken mental health system before we even had COVID. Okay. And I have researched this. I was a researcher at the Pennsylvania House of Representatives for 25 years. And my job was to find out what's going on and what we can do to change things. And so now with COVID, out of everything bad comes something good. And what I see as a good here is that finally the whole world has awakened to the fact that mental health is physical health, and that we have had a problem because we haven't done the things incrementally that needed to be done over the past 50 years. And now we are in a crisis. And yes, we are. And I just said to someone the other day, if you haven't had a meltdown, you are a very, very special individual. And I'm talking about every age group, every age group. And so, yes, I have a lot of knowledge on this, and I'm just thankful to be able to be here tonight, because it's exactly what I want to do with my entire life, is I want people not to get sick from mental health problems. And if they do, to get help quick and get well as soon as possible. And our researcher, our science advisor, is a neuroscientist researcher from Yale University. And I asked her for a 21st century definition of a mental health condition. And that's easy. This was about 2.5 years ago. A mental health condition is a physical medical condition with cognitive and emotional symptoms. And so we have known that it's physical because it's part of the body and the head's connected to the body. So what we need to do is what Dr. Brown said. We have to do better outreach. We have to do better education. And that's why I started the American Mental Wellness Association, to educate for prevention, early detection, early intervention, scientific research, and cures for mental health conditions, which includes substance misuse, for the holistic health of the individual and society.
And we'll get to some of those specifics in a minute, but now I want to bring in Commissioner Carter. Commissioner Carter, you've heard them, the experts talk about what they're seeing, that people are having breakdowns, people are having meltdowns, but unfortunately, some of that means they have meltdowns and they hurt people, I'm assuming. So I'd like to bring you in. What are you seeing as a law enforcement officer, and what are your colleagues seeing?
Joyce, and we're seeing more and more violence. Violence is coming from kids who are younger nowadays. People must understand that we have more guns in this country than we have people, and, you know, accessible to everybody. You know, back in 2017, I started a program trying to take guns off the street because I just saw Harrisburg getting more and more violent, you know. And I made a statement, and I want to apologize right now because I guess I offended people the way that I said it, you know, but I really didn't mean any harm by it, you know, saying, you know, that we have to do something about these kids with these guns, you know.
Why would that offend anyone? I mean,
because I could see it in the way that I delivered that message. I guess it wasn't very personable, you know, because I was speaking as a police chief, you know, a police officer concerned for the safety of the citizens in the city. You know, I just saw more and more violence, more and more shootings, you know, like nationwide. Over the holiday weekend, July 4th, we had 233 homicides. We had over 500 mass shootings, you know. I am no mental health expert, ladies. I don't pretend to be. That's not my expertise right there. So thank God that you're all here because I want to learn too. I want to learn, you know, how we can help people. I know that I got together with Fran Chardo, the commissioners, Mr. Hartwick, and some other people, and we decided to get some mental health people riding with the police officers. We were the first agency in this area here to like do that, and now other agencies, they're following suit. I'm sure you heard about the Berry Hill Street shooting, the Laura Paxton shooting. You know, it's just not Harrisburg, is all over the central Pennsylvania area, Philadelphia, everywhere. You know, so what is the answer? And I know that throwing money at the problems just don't help. You know, I mean, they need some real in-house care and what have you. But the question becomes, do we have the right resources to give people what they need?
Exactly. And I will say, I got a message just as we were starting our webinar from a pastor, Reverend Catherine Boileau in York. And she's pulling together pastors from throughout the area to try to see what they can do. She says that the shootings over the weekend were just off the charts. So Dr. Brown, let's bring you, so what we're hearing, I think the connection that the commissioner is trying to make is this really a manifestation? Is what he's experiencing in the streets and with the gun violence and all of that, a manifestation of a mental health crisis?
I certainly think it can be. I mean, if we look at what children have access to at a younger and younger age and what they can learn and see is certainly something that is telling, you know, social media, movies, all kinds of things that they're witnessing. And when, you know, violence is normalized, it's something that just becomes part of their everyday life, and it's not even something they think of, but they're also being traumatized, and that trauma is not being treated, and they're not, you know, so they, you know, can certainly express their agitation or irritability or their anxieties through other means. And you know, and then not having access to, you know, someone to talk to, or, you know, having both parents or one parent, or, you know, working and just not having a great access to that, the mental health needs. I know Sharon said it earlier, it was broken. The system was broken. It wasn't a great system before COVID. And we certainly, I think, have broken it even more with the overload and the influx of people trying to access services, on top of trying to access services in our urban areas, and really getting that outreach out there and helping people recognize mental health is health, and that there's no shame in that, but also, you know, that it's more than just the kiddos, it's the families too. It's a systemic piece here that we're talking about. This is generational at times. And we think of, we're trying to problem solve and we want to fix this problem, but it's multifaceted. So we need everybody, really all hands on deck, working together to try to help, you know, create a system that is, you know, going to help all of our kids and our, you know, our future generations.
Tina, does it make sense that we're going to see more crime or more violent expressions of anxiety, so to speak? I mean, that's the other thing. I mean, we're not talking about just people feeling bad. We're talking about serious, issues, right? Clarify that for us.
Yeah. So, sure. Most of us are feeling bad as we come out of the pandemic.
Yes.
Hopefully, we'll feel better. But when we have kids who have been traumatized, and adults who have been traumatized, and they don't have the tools to express their anxiety, their anger, their fear in any other way, then they do often result to violence. Now, I will say that typically people who experience mental illness are not violent people. But when they don't have any other outlet or any other way to express themselves, that's often how it comes out. And then you add open access to weapons and you have a real problem on your hands. So that's really the key, in my opinion, is to make sure we provide tools for people to use to express their emotions in a more positive manner.
Okay, we're gonna come to the issue of how to help police better with this, but Sharon, I know in our last conversation you basically told people, if you have a mental health crisis in your own personal life or family, don't call police. Is what you said.
I did. I said that. And we have a policy for the American Mental Wellness Association that we will take anybody's phone call and return it. And I can't tell you how many people across this country call. My husband, my boyfriend, my son, my daughter were incarcerated because they did something. And I'm here to tell Commissioner Carter that I think he's terrific and that I don't think anyone with a mental health problem should be really going to the judicial system when we should be putting them in the healthcare arena as early as possible for the medical care they need. And I wrote during COVID, the rapid response plan for America's broken mental health system. And it's my 50 years background on this. And I'm going to tell you, I am so passionate about this that I want to see this solved before I go to my glory. And so this rapid response plan for America's mental health system is a white paper. And we use Pennsylvania as the example because that's where most of my research is. And I'm here to tell you that I shared it with my state representative and every representative in the state legislature in Pennsylvania and every senator. And Joyce said in our Facebook Live hour interview, she was going to check back with me. I'm here to tell you that my new state representative called me and said, Sharon, I want to introduce this as a bill.
Wonderful, wonderful.
And I wrote it.
Who is it? Who's the state representative? We need to give them kudos.
He's from Perry County. He's Perry Stambaugh, Representative Perry Stambaugh. And I told him that the suicide rate for farmers is high, very, very high, one of the highest. I know people don't know that. And we're a farming community here. And I told him, I said, well, I'm turning the whole system around. And he said, I understand.
The suicide rate for farmers, has that increased in the past year or so?
You know, I don't know if it's increased, but I know it's been high for several years.
Got it. Commissioner, let's bring you back in. You've heard this. Do you feel that police are just at a disadvantage because so many of the calls may indeed involve mental health, but are you prepared? Do you really have the resources you need to respond correctly? Let me unmute you. There you go.
Here I am. Can you hear me?
Yeah.
Okay. When you talk about the mental health situation, that's a broad subject matter right there because there's many forms of mental health. Now, as Sharon was saying, she doesn't believe that incarceration is the answer. Well, I don't either, but I do know that when people who are suffering from mental health problems, when they get into the system, they're diagnosed by professionals in the criminal justice system.
Mm-hmm.
Right.
I don't believe, that if we do nothing with them, they're not, some will, some won't. Some families help, a lot of families help, but for the most part, they're not going to go and seek the help that they need. And so, what is the answer? Because, I was reading a big reader of books and articles, and they say, you know, that in this country right now, we don't have a mental health problem. We have a criminal problem. You know, so, and I'm sure that you ladies have heard that too, you know, because there's different opinions in everything. You know, I would like to, you know, I believe that is a combination of both, but, you know, what is the answer? Because this is not a quiet storm that's going to, you know, just pass over. It's going to get worse before it gets better. And I'm trying to get my agency all the mental health training that we can possibly get, but the training that we get, is it the right training?
Right.
Is it the right training? Because that's not our
training. Who determines what kind of training? Who are you going to for the training?
Well, right now we're going through the county. We have representatives from the county, you know, who are experts in the field. And so, you know, we're going through their training, and it's working because, you know, we talk people from jumping off of bridges. We stop people from like shooting themselves. You know, we taking guns off of, you know, people and different things like that. But the concern that I have is that, you know, how are we going to be equipped to do the right thing? Like in the hostage standoff that we had the other day, you know, is that mental health? You know, when you talk about mental health, you got to talk about drugs and everything else too, you know, because there's other things that come into play. You know, right now, I don't think that the police nationwide, I don't think that we're trained well enough to handle the mental health crisis. I'll be totally honest with you. I mean, we're learning day by day, but we're always playing catch up, you know? So Dr. Brown, how do you feel about that?
Thank you for adding go, Dr. Brown. How do you feel about that?
I think you hit the nail on the head. I mean, that's so accurate. I mean, it takes me 10, 12 years. It takes someone to become a psychologist, and, you know, to expect, I don't know how long police officers train, but I suspect that it's not 10 or 12 years that you go through the police academy, you know, and you have to learn, you know, so we're asking a professional to do a job of another professional and not have adequate training. I think that's really an unfair advantage. But yes, I do think there needs to be more training and understanding and awareness. But where is that happening, and when is that going to happen? And I think that's where we're, you know, that's the perplexing state. So, you know, do we start, you know, training new cadets and adding that into the training? And are they going to be willing to want to add another year onto their training process before they're out on the streets working? And but yeah, I really think that this is a complex issue. This isn't just, well, it's this and that's it. It is very complex, and it takes in so many different factors. As the commissioner said, we're talking drugs, alcohol, you know, people who do have readily access to weapons, anger issues, you know, lack of tools, lack of awareness, you know, so many other factors that go into this. And, you know, yes, we're asking our police officers to diffuse situations that they've had very limited training on. So
that breaks my heart too is that we're talking about children here too. We're talking about young people, right?
Yes.
So many of them, and that's heartbreaking, because if it is mental health, if there's a mental illness, there ought to be another way to deal with it than to throw them in jail or risk their lives by police. I mean, they're coming in, they're there to protect other people from them, right? So Tina, I'm wondering, should there be some sort of national you know, task force called to take a look at this? I'm taking what you say seriously, but are government officials taking it seriously?
So I agree with Dr. Brown. It is a multi-tiered issue. And I think that one of the best ways to approach it is to prevent people from interacting with the police in the first place. So if we use prevention with young people at a very early age, and help them learn coping skills, frustration tolerance, and give them the tools that we spoke about, that's one approach. And the second approach is to make sure that communities have adequate services to respond, and that 911 operators are trained to recognize when it may be a mental health issue, and make sure that mental health folks are on site, either themselves or with police officers if necessary. But if we can avoid that interaction from the get-go, we have a much better probability of being able to intervene with people without without getting into a dangerous situation. And then the police training, of course, I think is an excellent idea. And most police departments are embracing mental health first aid. They're embracing CIT training, that crisis intervention training, where they partner with counties in Pennsylvania to approach people differently and to learn about mental health. And then, yes, I do feel that there needs to be a national and at the very least a statewide approach to training of police officers and kind of doing mental health services in a united way, so that we can all be working together to avoid situations exploding to place where they don't need to be.
Right. Sharon, I know you've given a lot of thought to this. You have a white paper, you're reaching out to the representatives. What really should happen here? I mean, if you were to offer your guidance for, let's say, 5 things that ought to happen, what would those things be? Or maybe it should be 3 things that ought to happen.
I just want you to know that, yes, I do believe that I've analyzed it over 50 years because I had a sister that I had to admit under the new law in 1976, the Mental Health Procedures Act. She was 19, she went to college, she got sick. She was very, very smart and she got sick. And so this is where my passion comes from. And what you can do is, please, people, listen to me, because I have had the opportunity to analyze this at a state and national and local level.
So we got your credentials. We bought into that. Tell us.
All right, here it is. Here it is.
Mm-hmm.
Especially Commissioner Carter. Mental health problems precede a substance use disorder, an addiction, by about 3 years. And we have at the national level under SAMHSA, the Substance Abuse and Mental Health Service Administration, a prevention for substance misuse, but nothing on prevention for mental health. Nothing on early detection for mental health. They might have a prevention for mental health week, okay? But we don't have a center. And actually, if you deal with the mental health problem, that's the core of the problem in many, many criminal and civil offenses. And we can do this if we do the right thing this time. That change, the law's been around since 1976 and we haven't changed it.
So Sharon, what are you seeing as the way to prevent it? Are you talking about things happening in schools that counselors are trained to look and to identify? What clearly would you, and if you're not in the school, would it be the workplace? What?
Okay, this is a good question. And as you know, we have precedent setting cards here.
Mm-hmm.
And the reason we did this is because nobody else was doing it. These are physical medical conditions with cognitive and emotional symptoms. And just like other physical medical conditions, they have a first stage, second stage, third stage, fourth stage. Right. So when we talk about suicide, or we talk about addiction, or we talk about gun violence, that's 4th stage of a mental health problem in many, many cases. And so what we do is I'll show you our middle school, high school card that we have. This is our high school card and adult card. This is prevention. This is what you do to prevent a mental health problem. And it says that a healthier mind is a happier life. Mental health problems are medical conditions and need to be addressed early by licensed medical professionals. And here is stage 1. Here is stage 2 signs and symptoms, stage 3 and stage 4.
So basically what you're doing is educating and training people, the counselors and teachers in the schools. Do you do the same in the workplace? Is that?
Well, I wish that was the case. I wish that was the case. Very hard to break into the schools because they all think they know it all. Sorry, I really care about them. I've been in the schools. We have a happy life presentation we do. We have a healthy mind, which tells about the signs and symptoms. We just wrote a book called Understanding Your Anxiety for Elementary Students and Children.
So
that has done.
Ideally, you do think there should be training, consistent and ongoing training in schools at all levels.
The right training.
Workplace, right. The right training, whatever that the experts say that should be, but training in schools so that you can identify it and head it off, right? Training in the workplace, Is there any other place training should be done outside of schools and the workplace? Families should, community centers?
Absolutely. I want to tell you that there's a Iowa town that just came up with free mental health first aid trainings in the town. Now, my dream, I actually was one of the first 100 trained in the United States in mental health first aid. I really wanted to train the Harrisburg Police Department, but we had to charge, and they were able to get their training through the state and the state correction institution. And actually, to tell you the truth, Commissioner Carter, we train a little different than that, because we believe these are physical medical conditions that should be addressed with prevention, early detection, early intervention, education, and starting at the young age, getting into the families. And I dream of having mental health first aid, free classes for family members, especially pro-equity. Now, I do not like anti-racism terminology, because I believe the majority of people in the United States are not racist, but what they are is they're kind, loving people. And we all want everybody to have the medical care they should have at every level, regardless of color of skin, regardless of where they live. And I do know that the Harrisburg city needs more education. In fact, Dairy Street United Methodist Church was one of my first places that I did mental health first aid training. And that's right in
a member of Dairy
Allison
Street.
Hill.
I used to, so let me bring Commissioner Carter back into. Commissioner, you've heard some of this. It also raised in my mind, you know, people who have stressful jobs. I have one, I'm on deadline all the time, right? But police have severely stressful jobs. What's happening with training and mental health care for officers now, for law enforcement? They must really be under stress now with I mean, not just with COVID, Black Lives Matter and extremists, I mean, all over the place. There seems to just be anxiety and pressure.
And that's very true. I want to go back and address some of what Sharon said.
Okay.
You know, like I said, I'm not an expert when it comes to mental health or anything like that. But what I do tend to see and understand, like, you know, there's different levels to the mental health situation. And I understand, like, you know, there's a aggressive situation to the mental health problem. And those are the people that tend to worry me, and police commissioners like me. Those are the ones that tend to don't think a situation the whole way through, and they resort to violence. You have to get those individuals at a very young age. But I admire what you're saying, Sharon, but you know, you're talking about going into households, you're talking about the buying in of the whole family to combat the mental health situation at an early age. And some people just don't have that buy-in, and they will never get that buy-in, unfortunate, you know, as that is, you know. And I think that everybody is good-hearted, you know, but they have to be directed in the right way. I do know that if you go to prison, incarcerated, you know, they do have mental health programs for you. I do know that before your release date comes up, you know, they put you through mental health classes to make sure that you're going to hit the streets and get off to a good start. It's just that right now, you know, we're just living in a different time area, you know, where the sensitivity is gone. You know, people don't socialize the way that they used to. The pandemic and the COVID and unemployment and economy was just a perfect storm, so that, you know, everything is the way that it is. As far as police, you know, we have counselors, you know, we go, you know, we talk to people on Copline, you know, we can reach out to different people. We have different people here in like Harrisburg and the surrounding areas, you know, that we go reach out to. Me, I sort of like pressure, you know, diamonds were made from like pressure. I'm not going to, you know, crumble under pressure. You know, that seems to just make me perform better, you know, but everybody isn't like me, you know. So do I feel it sometimes? Yes, I feel it. I need a vacation. I haven't had a vacation in over six years because everything that is going on, you know. So yeah, I feel it, but
Commissioner.
Yes, I feel it, but however, it's the occupation, that I chose because I like helping people, and I'm going to do that as long as I can possibly do it. So I hope I answered your
Also,
question.
it's his passion, just like yours. Your passion is trying to correct the mental health system. Sharon, his is policing and protecting the community. So I get it. Tina, let me ask you this. You heard this. What I was also getting at is that right now, so many professions are under extraordinary stress that shouldn't they be places that you would want to have a targeted approach? Your first responders in the medical profession, definitely police, definitely fire. I mean, wouldn't that be taking up Sharon's idea of getting in there and train, getting early? Aren't there certain professions that this just cries out for?
Absolutely. And I think that to piggyback on what Sharon said, our counties do mental health training for free in the community, and we offer it in many different workplaces as well, churches, because really it's those natural supports where you're going to recognize those mental health issues first at the first sign so you can get that early intervention. And yes, I think that it is so important to have training and support and mental health support in those high stress professions, including the medical field. And I think that a lot of employers have employee assistance programs that people can reach out to, but often employees are fearful of going to those because they're afraid that the employer is going to find out what they talk about, even though it's really not the case. But expanding that availability into different professions is absolutely an important thing. And that support, amping up that support right now, where the stress and the pressure is turned up to high heat.
Yeah. Go ahead,
Wait,
Sharon. You want to add something?
Commissioner, and bipolar illness is one of the most treatable of the mental health conditions. Unfortunately, it's the least diagnosed early. And a huge side effect of depression and bipolar is irritability. And if you don't know that, and you don't treat this person who has maybe irritability because of the fact that there's something medically wrong with them, then it's going to escalate and it's going to escalate. And so there's so much we can do. And I'm really happy to tell you that we're working with Camp Curtin YMCA, and we are going in with our understanding your anxiety for elementary age students, and teaching the campers this July. And we're training the YMCA staff. We already did that in youth mental health first aid, and we're training the Shalom House staff in adult mental health first aid. And all of this is being done through grant money that we got from TFAC and the Stabler Foundation, and that is running out. And we need grants to help us to be able to do that and to help us to stay alive. If you look at our website, it's a one-stop shop hub on mental wellness and mental health problems, and from all stages, all levels, and even the military. My nephew was a police officer, Willis Cole, shot and killed in the line of duty in New Cumberland, and my family went through a terrible time, and we still are damaged by that because of so much. Plus, we have people that are in the family that were, because of that, they came down with mental health conditions.
Sure.
And I can tell you, because they knew that they were physical mental health conditions before they got sick, they knew to go to their family doctor and get treatment early. And so we have family doctors. They can treat early, but when they get severe, we run into real problems because we don't have enough of child psychiatrists and child psychologists, or we don't even have the hospitals having enough of beds to take these people. And it's time. It is time.
Let me bring Dr. Brown into this. Dr. Brown, because I know that was one of your concerns, even as we're now in the summer months. So I'm hoping kids are getting somewhat of a break, although maybe that's not the case. Maybe the pressure is still on. But when they return to school, and I mean, are we looking at another set of critical areas where kids are going to need counseling help and there's not going to be enough resources.
It's certainly a possibility. I mean, that's kind of what I've seen. Usually in the summer, that's our slower months in the mental health world, at least at my clinic. We kids are out of school, there's vacations, there's less pressures, there's, not as much demand on them, not as, same rigorous schedules, et cetera. But, once they go back to school, and especially in the fall, if we were, if most schools are, returning in person and they've been, doing virtual school, it's certainly going to be, we're going to see some more triggers for some kids. It's certainly going to be a struggle. I have no doubts about that, especially our kids with anxiety disorders that were doing well on virtual school because they didn't have those social pressures and now are all of a sudden going to have to return to the classroom where there are struggles. And my concern is that there's just not going to be enough resources because I know my clinic, we are all busy. We have full schedules. Most of us don't have an hour to take a lunch. We are certainly working as, we are working as every hour that we possibly can, just like most other professions. And we already are short-staffed, trying to find those resources and plugging them in the school system. Most schools only have one school psychologist or two, and maybe one or two counselors, and that's just not enough for our kids. And certainly, teachers get taxed into, doing some of that. Counseling, so to speak, on the fly. And so, we're asking a lot of all of our professions to support our kids and their families. And that's why I said we just all need to work together to try to help resolve these issues that we're having. And recognizing, certainly it does come down to money and having the resources to start them. These projects or clinics or certainly the education piece and starting at the beginning. And there has to be, someone said it, there has to be that buy-in from the beginning of that mental health is health. This is nothing to be ashamed of. And that resources and having the tools are so valuable and important and are life-changing and in some situations life-saving.
Right. So Tina, if you had what 3 things that you would do that you think need to change to address it? Because I hear Commissioner Carter, he's asking at the beginning, what are we to do? When we respond, we have to control things. We have to protect lives. What do you see? There is obviously a connection between mental health issues and violence, and there is a connection. You said not everyone, but there is. What do you think needs to happen to address that?
So I think that, again, there are multi-tiers, and to narrow it down to 3, I think prevention at an early age, even before elementary school, when kids are in daycares and preschools, I think that there are skills that can be taught that can carry through throughout their school years and into adulthood. So I think that's one. The second is expansion of funding for youth services within the schools, within the community. Kids are on their own way too much. If they're not in school, there is often a lack of structure through no fault of anyone. It is. Parents have, both parents are working in most situations. They're out of the home, sometimes doing 2 jobs. So kids are often left unsupervised, and they need that structure with people who can send a positive message and continue to teach those skills. And 3, I think, is community training, including police officers, so that we can have those co-responder models and to really have a recognition of when it's a mental health issue and when it is a criminal issue, and how to respond when it's not a critical safety issue.
So Commissioner, you heard those 3 things. Does that ring true for you? Is there anything else you would add as you try to figure out how to deal with this this surge in violence that may or may not be connected to mental health?
I first want to say, Sharon, Willis Cole, myself, I worked down at Harrisburg Hospital with Will Cole. He left to go to the West Shore to be a police officer. I left to come to Harrisburg to be a police officer. I was a security supervisor down there when we did that. So he was an excellent guy, and it was just a tragedy when he got shot and killed.
It ruined our
family.
it ruined our family because it ripped us apart. Shot like a dog was the head of the headline the next day.
Yes.
So all I want to tell you is there is something that people think trauma is a cause of mental health problems. It is not the cause. We have people that live with predispositions that have a mental health predisposition. And so if they have that and trauma happens, that's a risk factor. And that can bring that to the surface. And so what we need to do is get the medical community to start providing the services that these people need. It was 1 in 5, now it's 3 in 5 people. And they aren't providing the services we need because there's a lot more money in treating cancer and lung disease and heart disease. But more people suffer from mental health conditions than lung disease, heart disease, and cancer combined. And I'm a researcher. I know that I'm telling you the absolute facts. And it's time. I've been working 50 years, and to not have enough of medical beds for people over those 50 years when I tried to admit my sister, and then there wasn't a bed, we had to go to, Danville, we had to go somewhere else. No. These people have physical medical conditions. If you're going to treat someone with a stroke that has a psychotic episode, then you better treat my loved one who has a physical medical condition with cognitive and emotional symptoms and might have a psychotic episode because they can't get the medical care that they're supposed to get. So I've written a bill. And in that bill, Commissioner, is a lot. And I would like to share it with you. I would like to share it with everyone. Our rapid response plan for America's mental health system is free to look at on our website under the tab Resources, American Mental Wellness Resources. It's the first document on the right, on the first row. And from that, I drafted a bill for Pennsylvania. And if we don't need to find more money, you know why? Because we need to take the money that's being frivolously spent because we're not solving the problem. 50 years, we haven't solved the problem. You know why? Because the core of the problem is we need to deal with the mental health condition so they don't turn to drugs and alcohol, so they don't get so irritable that they become violent. And I do believe that we can reduce the number of people on the streets that have guns in their hands and everything through public education in every level. And
good, Sharon. I hear you. Let's let Commissioner Carter respond to some of this. Let's bring him in. Thank you for sharing that condolence for the family, but you were going to say something else about the issues involved.
Thank you for sharing that.
Yeah.
Yes. From what I see, that a lot of these kids, they don't know where they come from. They have no sense of pride because our history isn't being taught to them. They walk out of the house and the only thing that they see is like, rundown homes, drug packages and everything else. It is depressing. When I go out there, it bothers me. So we have to put more money into the city, to make the city look like every place else. It'd be nice to have a pool during the summertime that is open. It'd be nice to have a track to work out, for the kids, that is open,
Absolutely.
What we tend to do here is to pacify our kids by saying, well, we give you the basketball courts, but not every child plays basketball. We got to get into the arts. We got to get into other things like that. We have to let them experiment and express themselves. And in the cities all over the country, basically, that's not being done. So I can understand, why, some kids turn to other means of being involved in different things like that, but it doesn't make it right. But still, we have to be able to dump money into the situation here in order to make them feel, that their life is worth something too.
Commissioner, I was called in by Capital Academy, Capital Academy.
Yes.
And I was able to teach those students our healthy mind and our happy life. And those children and young people related to that. And we connected. And I taught these staff people youth mental health first aid. And if you had a community center in every place where you could get these young people to play, some like to be gamers and things like that, where we can teach them, like at the camps that we're going to teach this month, we're going to teach at the camps. We're going to give them information that is going to be valuable for them to understand their brains and how they work.
Well, Sharon,
I believe
I
we can
received an
do
op-ed from a company that said that people are actually using games, these kinds of video games, for mental health wellness and training.
Yes.
Have you all heard of that? Dr. Brown, have you heard of that? The use of gaming now as a mental health tool?
I have not, but I certainly can see how it would be beneficial, because that's where we have to meet our kids where they are. What are their interests? What are they liking? We have to meet them. And so many times as adults, we're like, well, let's sit down and talk about this, and let's do this. So we, if we can find a way to connect, because that's so important too. And that I can see how that would be a great attraction to kids. Like, you're talking video games. There's not a single kid or young adult that doesn't like video games in this. I think in this
Maybe
country.
that, is that something, have you heard of video games or other ways? But I'd like the idea of having neighborhood centers and having wellness things in those neighborhood centers. Is that being a priority?
Yeah, I have heard of that. I'm not sure of any specific platforms, but I've read some articles about how, approaching youth through that type of means, through video games, through online avenues, texting. Those are all things that are up and coming, because our youth don't want to sit down and talk face to face. They want to be more active. And community centers, again, I totally agree. Structured activities where you have a captive audience, so to speak, to teach those positive skills. It's a great way to approach things. And then you just have that positive adult interaction with them as well, so that you can model appropriate behaviors.
And I do think the parents, many of them, care about their children. There's
Absolutely.
people in Center City that uptown, downtown, whatever, they don't want this shooting in their communities.
Well,
and if you had the ability to do the health training, you could train them too.
Absolutely.
And so the parents need, I would do, if you could get me grant money to teach mental health first aid to the family, the parents or whatever, I would do a cartwheel.
That's a very good thing. Well, let me just do this, because we're closing in on our time, and people are commenting and they're angry that I haven't taken their comments. So I will just simply say that there are a lot of comments here that have to do. One lady is offering to help the police with training, but we've got a lot of offers here for training. And we have another person apparently asking for the hospital to reopen. And can't we get another state hospital open, they're asking. I don't know if that's something that people really might want to support. And someone is saying changing the medical community is tough because of how they are taught in the medical field. It looks like they're thinking changes should happen in the medical profession in general with how this is happening. So what about this issue of there needs to be a hospital reopened? Have you guys got any comment on that, Dr. Brown? Because that was close, thinking that wasn't the right way to treat mental illness.
Well, yeah, we have, in the mental health world, the historical nature is we've waxed and waned in how we've treated the mental health patient. And so I have not heard any chatter about reopening the state hospitals. I know we as professionals often look at, unfortunately, our prisons are now our state hospitals. That's kind of how we see it. So
wait, Sharon, let me just get to these. Charlotte is saying that the Pennsylvania No, Charlotte's saying, let's start with recreational activities like a skating rink. I'd like to hear if you guys think this, or a skating rink, neighborhood community centers. How about a skateboard park in the city? The county just funded an expansion of the park in Steelton. There's not a lot of free structured activities for the city's children, she's saying. And she wants
I can say something, Joyce.
Yeah, go ahead, Commissioner.
I think it was Tina or somebody that said, maybe I'm wrong, they're saying, that today's youth don't like to really socialize, anything like that. And I believe, that that's a big problem that we're faced with right now, because I believe that if kids would socialize with each other and become personal with each other, and then, you would have that genuine feeling for that person, then you wouldn't want to harm people, and the violence would cut down. It'll never stop, but it will drastically drop, because someone that you get to know, somebody that you're personal with and you have feelings about, you're not going to want to harm them.
That's right. Someone is asking, how are we going to stop the gun violence? That's exactly what we're talking about here. If it's connected to mental illness, we're talking about how to impact that. But we're close, we're at the end of our time, but let me just ask you this. Commissioner, we heard Dr. Brown say this is generally a slow time, that kids and young people, they're relaxed now. There should be less cause. But you just told us that you don't see that happening. And I'm assuming a lot of the violence that you're seeing is coming from young people. As you look out for the summer, what are you seeing? Are you seeing a reduction, or are you seeing that things are going to get worse?
Well, I can only hope that, things slow down and that they get better, but, right now, things tend to be trending upwards. Anytime, you have a lot of violence in the townships, that's not a good sign. That's not a good sign at all. We're going to do what we can do to make the residents here safe, and, we're just asking for help. I team with the federal government, with the state government, with the county government, with everybody to do what we can do to make Harrisburg a safer city, because it's the capital city and people want to come here, they want to work and they want to play and they want to do everything else. I'm also talking to Commissioner Muldrow from New York. I'm going to meet him. Terrell Landis from Carlisle, I'm meeting up with him. Johnny Bay from Lancaster, Chief Bay from Lancaster, we're all meeting together. I talked to Rob Martin here. I talked to the surrounding police chiefs, and we all feel the same way. We're here to support our citizens, to keep them safe, and to hope, that we can keep a lid on things.
And Commissioner, have you seen a change in how police respond to calls that may be mental health? Have you seen that actually change?
Yes, because usually what happens is that, when whoever calls in, the dispatchers are also trained, and they ask, is there a mental health call, or what is it? So if there's a mental health call, when we get there, we let our CTI people handle the call until they can't go any further with it. Then, once they can't go any further, that's when we, tend to step in. But we have well-trained people. Our responders are excellent. I'm really proud of them, and they really helped us out an awful lot. And anybody who's listening, anybody that wants to, offer training, to the police, call me, come and see me, and we'll sit down and we'll talk about it.
You'll at least entertain a proposal for sure. Somebody is saying, what about when guns are drawn and police are called but nobody responds? Well, is there a problem with police being able to respond to calls? Is that an issue for you here or elsewhere? Have you heard of that?
Some days, we get more calls, than we can handle. And, we got to take the top calls, prioritize them, and just try to, get to everybody, so I would imagine you see, but the thing is that a lot of people, they call and they say, that there's guns drawn to get the police there quicker, and there aren't guns drawn, so, but, we want to respond to everybody's call, we're going to get there. It's just that, during the summertime right now, it's just busy.
Right.
It's just busy.
So if someone is saying if they do have a proposal they want to offer you, should they contact Katie, or who should they contact to set up a time to talk to you, Commissioner?
They should contact my secretary, Jennifer Cameron.
Jennifer Cameron, okay.
Yes.
If you call the police office and ask for Jennifer Cameron, she will help direct you and set up a time where you can talk. That's from Anna White, who's asking that. So,
okay. Hello, Anna. How you doing?
She's there. All right. So I thank you. I want to thank Tina because that's going to help me when I write this up, the 3 things that she suggests. But I'm going to quickly ask Dr. Brown and Sharon, just quickly, if you had to say what needs to happen now to deal with this crisis, as concisely as you can, what would that be? Sharon, we'll start with you and we'll let Dr. Brown have the last word.
We need a public education program going on right now. I mean, buy some billboards, get out, tell people that this is a crisis time, that we're all trying to heal from a nightmare, and that if you start feeling these signs and symptoms, don't continue to get sick. If you had a sore throat, go to the doctor. Now, do we have enough of medical care in the places where we need it? I don't think so. We need to make sure we do. We need to work more on healthcare clinics and things. But a public education campaign right now in the places that are needed, just like where he's going for these next couple of meetings with people, is imperative.
Nicole, I think she's asking, how do we do this and gather together? Well, people are having small gatherings. You can still get together outside, and smaller gatherings where people are still distanced, especially if they're not vaccinated, is still one way to approach this. But I think, you know, the issue came up, community centers. We need more of this happening in neighborhood centers and schools where the children are at camps. It needs to be a part of, right now, it sounds to me, it needs to be a part of everything we're doing. How do you stay mentally healthy? Dr. Brown, why don't you have the last word on this?
So how do you stay mentally healthy? Yeah, I think, you know, again, just to echo what Sharon said, you know, we need boots on the ground to help these kiddos to learn the skills. And, you know, staying mentally healthy, we have to take care of ourselves too. It's not just, you know, taking care of everybody else. It's learning the skills yourself as an adult so you can model those for your kids and teach them. And, you know, because kids learn through role modeling, what they see, wherever they see it is what they're going to emulate. And if you are, you know, showing those good skills, so, you know, educating yourself and learning and asking questions. And I really do think, you know, we all need to, you know, support one another and kind of have that community again, you know, where we can, you know, support and help. Like if you need childcare, you need some, you know, money for food or something like that, you have someone to turn to. And you know, so just in a nutshell, it's just kind of giving that hand out to someone who needs it.
Got it. And Tina, I see it's written, many of the people who we see in correctional facilities are not individuals who qualify for a state hospital. They are people who were never involved in services before. Detection and intervention in the community would prevent their involvement in the criminal justice system. Thanks for that, Tina. And I want to thank each one of our mental health professionals for being here with you. Your expertise is so highly valued and so very much needed right now. And I hope you'll join me in thanking Commissioner Carter for being there, for being willing to engage with his community. He comes to things like this when he has a lot of other stuff to do, but I hope you will also join me in urging him. Take a vacation.
Yes,
absolutely.
Yeah, you need a vacation.
I do.
That's how you stay mentally well.
Yes.
With that, I want to thank you all, and I want to thank our dear audience, our readers, for being here with us. We will continue this discussion in a few weeks, where we will be talking about another aspect of mental health, COVID-19, and what are we facing as we hopefully emerge from this trauma. So with that, thank you all. Enjoy the rest of your evening. Stay cool.